I want to talk to you today about something that a great many older adults underestimate when it comes to their hearts, and that's both real and often misunderstood: the connection between stress and your heart. Because people tend to think of stress as just a feeling, a mental or emotional thing, separate from the physical health of the heart, when in fact chronic stress genuinely affects the heart and cardiovascular health in real, physical ways. And yet it's also a topic where claims can be overstated, so it's worth understanding accurately. So today, I want to explain the genuine connection between stress and the heart, what the evidence supports, how chronic stress affects cardiovascular health both directly and through behavior, and, most importantly, the practical ways to manage stress that genuinely benefit your heart, in partnership with your doctor. And I'll keep this calm and practical because while stress genuinely matters for the heart, managing it is something you can do, and understanding the connection without overstating it lets you protect your heart through stress management as a real part of heart care, alongside the other measures and your doctor's care. This is about genuine, balanced understanding and practical action. Let me start with the genuine connection between stress and the heart, because understanding it shows why managing stress matters. Stress is the body's response to demands, threats, or pressures involving both how we feel and a physical response, the release of stress hormones and changes that, in the short term, prepare us to cope, raising the heart rate and blood pressure, the so-called fight or flight response. This short-term stress response is normal and not harmful in itself. The issue is chronic stress, ongoing, prolonged stress over time, which keeps the body in a state of activation, and this is increasingly recognized to affect cardiovascular health in real ways. Chronic stress is associated with higher blood pressure, and the ongoing stress response and its hormones can affect the heart and blood vessels, contribute to inflammation, and over time relate to increased cardiovascular risk. So the genuine connection is that while short-term stress is normal, chronic, prolonged stress genuinely affects cardiovascular health through its physical effects on blood pressure, the heart, and the blood vessels. So stress is not just a feeling, but has real cardiovascular effects. Understanding that chronic stress genuinely affects the heart in physical ways, not just emotionally, is the foundation for taking stress management seriously as part of heart care. So chronic stress genuinely affects the heart physically. So the real stress-heart connection is the foundation. Let me explain the second, equally important way stress affects the heart: through behavior. Beyond its direct physical effects, chronic stress affects the heart powerfully through its influence on behavior, which is genuinely important and sometimes overlooked. When people are stressed, they often engage in behaviors that harm the heart. They may eat poorly, turning to unhealthy comfort foods or overeating, drink more alcohol, smoke or smoke more, sleep badly, which, as I've discussed, itself affects the heart, exercise less, and neglect their health, including their medications and self-care. So, chronic stress, by driving these unhealthy behaviors, indirectly but powerfully harms the heart, on top of its direct physical effects. This behavioral pathway is a major part of how stress affects cardiovascular health. And it's important because it means managing stress isn't only about the direct effects, but also about avoiding the harmful behaviors stress provokes, and, conversely, that healthy behaviors both manage stress and protect the heart. So stress affects the heart both directly, through its physical effects, and indirectly, but powerfully, through driving unhealthy behaviors like poor eating, more drinking, smoking, poor sleep, and less activity. So managing stress protects the heart on both fronts. So the behavioral pathway is a major, often overlooked part of the stress-heart connection. So stress harms the heart through behavior too. Let me be balanced about this, because while the connection is real, it can be overstated. I want to be accurate. Chronic stress genuinely affects cardiovascular health, both directly and through behavior. So it's a real part of the picture worth addressing. But it's not the whole story or a simple single cause. And the relationship is complex, intertwined with the established risk factors and behaviors. So I wouldn't want you to think that stress alone causes heart disease, or that managing stress replaces the established heart-protecting measures like controlling blood pressure and cholesterol, not smoking, and the rest. Or to feel that any stress is dangerous, since some stress is a normal part of life, and short-term stress isn't harmful. The balanced truth is that chronic stress is a genuine, worthwhile thing to address for your heart, as one real part of a bigger picture, alongside and intertwined with the other measures, not as a sole cause or a replacement for them. So respect the real connection. Chronic stress genuinely affects the heart. While keeping it in proportion, it's one real part of the picture, not the whole story or a substitute for the established measures. So hold the stress-heart connection accurately, real and worth addressing, but one part of a bigger, intertwined picture. So accurate balance keeps stress in proportion. Let me give you the practical ways to manage stress that genuinely benefit your heart, because this is the actionable heart of it. The encouraging thing is that managing stress is achievable, and many stress management approaches also directly benefit the heart. First, stay physically active, since exercise, like the walking I've discussed, is one of the best things for both stress and the heart, reducing stress while directly protecting cardiovascular health. A wonderful 2-for-1. Second, attend to good sleep, since poor sleep both results from and worsens stress and affects the heart. So the healthy sleep habits I've discussed help both. Third, use relaxation and calming practices that genuinely reduce stress, such as slow breathing, relaxation techniques, mindfulness or meditation, gentle activities like spending time in nature, hobbies, or whatever genuinely relaxes you, which can calm the stress response. Fourth, maintain social connection, since relationships and support buffer stress and benefit well-being and heart health, while isolation worsens both. Fifth, avoid the harmful stress behaviors, not turning to smoking, excess alcohol, or poor eating to cope, but using healthy outlets instead. And sixth, address sources of stress where you can, problem solving, seeking support, or adjusting what you can, and accepting what you can't. So, staying active, sleeping well, using relaxation practices, maintaining social connection, avoiding harmful coping behaviors, and addressing stress sources where possible, all genuinely manage stress and benefit the heart, several being 2-for-1. So practical stress management, much of it also directly heart healthy, genuinely helps. So manageable stress practices benefit both mind and heart. Let me give you the rest, including when stress is more serious and help is warranted. Sometimes stress is severe, persistent, or tied to anxiety, depression, or being overwhelmed. and this matters both for well-being and for the heart, since these two are linked to cardiovascular health. So if you're struggling with persistent stress, anxiety, low mood, or feeling overwhelmed, it's worth seeking help from your doctor, who can offer support, suggest approaches, or refer you for talking therapies or other help, since managing significant stress, anxiety, or depression genuinely benefits both your mental and your heart health. There's no shame in seeking such help, and it's a real part of looking after yourself. Also, keep up your heart care while managing stress. Don't let stress lead you to neglect your medications, appointments, or healthy habits, and take any prescribed medications consistently. And remember that stress management complements, not replaces, the established heart-protecting measures and your doctor's care. So seeking help for severe or persistent stress, anxiety, or low mood, keeping up your heart care despite stress, and remembering that stress management complements the established measures, all complete the picture. So address significant stress with help and keep stress management alongside your broader heart care. So seek help when stress is serious and keep up heart care. Let me explain why managing stress matters for the heart, because it's genuinely worthwhile. Managing stress matters because chronic stress genuinely affects cardiovascular health, both directly through its physical effects on blood pressure, the heart, and the blood vessels, and powerfully through driving the unhealthy behaviors that harm the heart. So addressing it removes a real, two-pronged source of harm. And it matters because the ways to manage stress, activity, good sleep, relaxation, connection, and healthy coping not only reduce stress, but often directly benefit the heart and overall health. So stress management is a doubly valuable part of heart care. It also matters for your well-being and quality of life, which are worthwhile in themselves. So managing stress matters because chronic stress genuinely harms the heart directly and behaviorally, because the ways to manage it also benefit the heart, and because it improves well-being, all of which makes stress management a genuine worthwhile part of heart care, as one real part of the bigger picture. This is exactly why understanding the stress-heart connection accurately and acting on it through practical stress management is worthwhile. So managing stress genuinely benefits the heart and well-being. So stress management is a worthwhile part of heart care. Let me paint you a picture of how addressing this helps. Picture a man in his 70s under chronic stress, worried and overwhelmed much of the time, who thinks of his stress as just a feeling, unrelated to his heart, and who copes with it in harmful ways, eating poorly, drinking more, sleeping badly, and not exercising, while his blood pressure runs high. In the unaware version, his chronic stress harms his heart both directly, keeping his blood pressure up and his body activated, and through the unhealthy behaviors it drives, while he doesn't connect any of it to his heart. Now picture him understanding the connection. He learns that chronic stress genuinely affects his heart, both physically and through behavior, so he takes stress management seriously as part of his heart care. He takes up regular walking, which reduces his stress and directly benefits his heart. He improves his sleep. He uses relaxation practices. He maintains social connection, and he replaces his harmful coping, the extra drinking and poor eating, with healthier outlets. Finding his stress and low mood persistent, he seeks help from his doctor, who supports him. His stress eases, his blood pressure improves, his harmful behaviors reduce, and his heart and well-being both benefit. The same man, but understanding and addressing the stress-heart connection protected his heart on multiple fronts. That contrast is exactly why understanding and managing stress matters for the heart. So addressing his stress protected his heart and well-being. And let me speak directly to those of you caring for or close to an older person, because stress affects the heart and you can help. Understand that chronic stress genuinely affects the heart, both directly through its physical effects on blood pressure and the cardiovascular system, and powerfully through driving unhealthy behaviors like poor eating, more drinking, smoking, poor sleep, and less activity. So it's a real part of heart health, though one part of a bigger picture, not the whole story. You can help by supporting stress management that also benefits the heart, encouraging regular activity like walking, good sleep, relaxation practices, social connection, which you can be part of, and healthy coping instead of harmful behaviors. You can help them address sources of stress where possible and, importantly, encourage seeking help from their doctor if their stress, anxiety, or low mood is severe or persistent, since there's no shame in it, and managing it benefits both mind and heart. Help them keep up their heart care, medications, appointments, and healthy habits despite stress. And remember, stress management complements the established heart measures. Helping a loved one understand and manage their stress with healthy practices and help where needed can protect their heart on multiple fronts and improve their well-being. So your support for stress management genuinely benefits their heart and well-being. Let me draw this all together. The connection between stress and the heart is real and often underestimated. While short-term stress is normal and not harmful, chronic, prolonged stress genuinely affects cardiovascular health, both directly through its physical effects on blood pressure, the heart, and the blood vessels, and through inflammation, and powerfully through driving unhealthy behaviors like poor eating, more drinking, smoking, poor sleep, and less activity. This connection is real and worth addressing, but it should be held in proportion as one part of a bigger, intertwined picture, not the sole cause of heart disease or a replacement for the established measures. Managing stress is achievable and often directly heart-healthy. Stay physically active, sleep well, use relaxation practices, maintain social connection, avoid harmful coping behaviors, and address stress sources where possible, while seeking help from your doctor for severe or persistent stress, anxiety, or low mood, and keeping up your heart care. This matters because chronic stress genuinely harms the heart directly and behaviorally, because managing it also benefits the heart, and because it improves well-being, making stress management a genuine, worthwhile part of heart care alongside the established measures and your doctor's care. So here's what I'll leave you with. First, understand that stress is not just a feeling, but has real physical effects, and that while short-term stress is normal, chronic, prolonged stress genuinely affects your cardiovascular health, both directly through its effects on blood pressure, the heart, and the blood vessels, and powerfully through driving unhealthy behaviors. Second, hold this accurately. The stress-heart connection is real and worth addressing, but it's one part of a bigger, intertwined picture, not the sole cause of heart disease or a substitute for the established measures like controlling blood pressure and cholesterol and not smoking. Third, manage your stress in ways that also benefit your heart. Stay physically active, like the walking that helps both stress and the heart. Sleep well. Use relaxation and calming practices like slow breathing, mindfulness, nature, or hobbies. Maintain social connection, and avoid the harmful coping behaviors of smoking, excess alcohol, and poor eating. Fourth, address sources of stress where you can, and seek help from your doctor if your stress, anxiety, or low mood is severe or persistent, since there's no shame in it, and managing it genuinely benefits both your mind and your heart. And keep up your heart care, medications, and healthy habits despite stress. And fifth, remember that stress management complements, not replaces, the established heart-protecting measures and your doctor's care. Managing stress is a genuine, worthwhile part of protecting your heart, both directly and by avoiding the harmful behaviors stress drives. And it benefits your well-being too. So it's well worth understanding and acting on. So take care of yourself. Manage your stress with healthy practices. Seek help when you need it. And keep up your broader heart care. And because severe or persistent stress, anxiety, or depression, and your overall heart care involve your doctor, please treat significant or persistent stress as something to address with your own physician, who can support and help, rather than as a substitute for that care. And keep stress management alongside the established heart measures.